It was a normal day for Julie Milne, a community paramedic in Kawartha Lakes, Ontario. She was driving to visit one of her regular patients, a 90-year-old woman who lives alone and has a heart condition. Julie is part of a program that provides in-home and remote health services to seniors who are waiting for long-term care or need extra support to stay safely at home. As she was driving on Highway 7, she heard a call on her radio. There was a man choking on a biscuit in his car, and he needed urgent help. He had pulled over to the side of the road, but he couldn't breathe or speak. He had tried to call 911 on his cell phone, but he couldn't get through. Julie quickly turned her car around and headed to the scene. She was the closest paramedic available, and she knew every second counted. She arrived within minutes and found the man slumped over his steering wheel, gasping for air. He had a half-eaten biscuit in his hand. Julie ran to his car and opened the door. She asked him if he could cough, but he shook his head. She checked his pulse and saw that it was weak and irregular. She realized he was going into cardiac arrest. She grabbed her medical bag and pulled out a hammer and a syringe. She explained to the man that she was going to perform an emergency procedure called a cricothyrotomy, which involves making a hole in his throat and inserting a tube to allow air to enter his lungs. She placed the hammer on his neck and felt for the cricothyroid membrane, a soft spot between the Adam's apple and the collarbone. She smashed the hammer down with one swift motion, breaking through the skin and cartilage. She then inserted the syringe into the hole and removed the needle, leaving behind a plastic tube. She attached an oxygen mask to the tube and turned on the flow. She saw the man's chest rise and fall as he started to breathe again. She also gave him an injection of adrenaline to stimulate his heart. She stayed with him until another ambulance arrived and took him to the hospital. She followed them in her car and gave them a report on what she had done. The man survived thanks to Julie's quick thinking and skillful intervention. He later learned that he had a severe allergic reaction to something in the biscuit, which caused his throat to swell up and block his airway. He was grateful to Julie for saving his life with a hammer and a biscuit. He said he would never eat biscuits in his car again. Julie said she was just doing her job as a community paramedic. She said she loves helping people and making a difference in their lives. She said she hopes more people will learn about the Kawartha Lakes Community Paramedic Program and how it saves lives and keeps seniors safe at home. After a few minutes of intense work, the paramedic managed to stop the bleeding and stabilize the patient's condition. He had used a hammer to break open a window and enter the house, where he found the patient lying on the floor with a severe cut on his leg. He had also used a biscuit to apply pressure on the wound and slow down the blood loss. He explained that he had no other choice, as he had arrived before the ambulance and had no medical supplies with him. The patient was rushed to the hospital, where he received further treatment and recovered from his injury. He later learned that he had suffered from an arterial bleed, which could have been fatal if not treated quickly. He was amazed by the paramedic's quick thinking and resourcefulness, and thanked him profusely for saving his life. The patient's family was also very grateful to the paramedic, and invited him to their home for a special dinner. They praised him for his bravery and skill, and gave him a gift basket filled with biscuits and other treats. They also made a donation to the Kawartha Lakes Community Paramedic Program, which provides health services to seniors and other vulnerable people in their area. They said that they were lucky to have such a dedicated and compassionate paramedic in their community.